So several things we're going to talk about today is the different body organs and structures that make up the body itself, and then how those are kind of grouped into body systems, and a little bit about what those systems do. I think it's helpful when you're trying to picture the body and the organs and the surrounding structures. If you have a good image in your mind, it's going to help you to better establish what body systems they belong to and how they serve the body. Let's start with the musculoskeletal system. There are three main functions of the musculoskeletal system, and that is to give us shape, to protect the internal organs, at least the ones that are most vital for survival, and to provide us with movement. When we think about the musculoskeletal system, remember that this is going to include not only the bones, but also the muscles and how they work together. So first, let's talk about the skeleton a little bit. Understand that this consists of the skull, the spine, the ribs, the sternum, and all of the other bones that extend out the extremities. And this is going to be what helps really form the structure of our bodies. So beginning with the skull, we know that this is the structure of the head. This protects the brain, and the brain is really necessary for survival. So it's pretty well encapsulated there inside the skull. The cranium is the top, back, and sides of your head, and then the face is obviously the front of the skull. Looking a little bit closer and breaking this further down, the cranium connects to the facial bones, and the facial bones include the mandible, the maxilla, the nasal bones, the orbits, and the zygomatic arches. You'll see a picture on the next slide that will help you to identify exactly which is which. Okay, here is a side image of the skull. You'll notice the mandible is the lower jaw and the maxilla is the upper jaw. We have each eye orbit, and underneath that orbit is the zygomatic bone, and this is really kind of like your cheekbone, if you will. You'll notice that the skull is made up of different plates. Those plates are the frontal bone, the parietal bone, and there are two of those. The temporal bone, there are also two of those. The sphenoid bone, there are two of those. And then the occipital bone in the very posterior back of the head, and there is one there that crosses midline. So again, thinking about the structure that the bones help to maintain for our bodies, we move down to the spinal column. The spinal column is made up of 33 vertebrae, and these help to protect or encase the spinal cord. The spinal cord is really important because the spinal cord is where all the nerves come off to help us with movement, sensation, and vital functions. The nerves not only allow us to feel, but they allow us to move in certain ways, and they help to control movement of bodily organs like peristalsis, which is the movement of substance through your intestines. The thorax, which is kind of the chest area, if you will, includes 12 ribs and the sternum, which is in the front or is anterior. This protects the heart, the lungs, and the major blood vessels. So we talked about the skull protecting the brain and how important that is. We also know that the lungs and the heart, along with those large vessels that help supply oxygen to every part of the body, they're all included in the thorax. And so this, again, needs to be well protected, and that's what our ribs and our sternum do. Take a look at this picture. This picture is showing the skull connected to the spinal column, and you can see here it's connected just at the inferior aspect of the skull. Now, you'll see the first section of vertebrae is called cervical vertebrae. The cervical vertebrae make up the neck and that connection point between the skull and the spine. This is a very particularly important area that we're going to talk a lot about when we talk about trauma and potential injury to this area, because remember, the spinal cord runs through these vertebrae, and it's going to branch off at every vertebrae, sending nerves out. The higher up the injury to the spinal cord is, the less abilities this individual is going to have, or the more deficits this individual is going to have. So when we talk about cervical spine injuries, especially of C1 and C2, I mean, these individuals don't survive those types of injuries. Any other injuries to cervical 3 through 7 can leave individuals dead or paralyzed, unable to feed themselves, and a lot of other of those functions that we maybe take for granted. As we move down, you'll see the thoracic vertebrae. They are 1 through 12, total of 12, and then the lumbar vertebrae are 1 through 5. The sacrum and the coccyx kind of make up your tailbone, and those are vertebrae, but they are fused together there. So if you think about this, it's cervical 7, thoracic 12, lumbar 5. If you think about the times you would eat, breakfast is about 7, lunch is at noon, dinner is around 5. That's how you can help yourselves to remember the number of vertebrae in each category. Okay, moving right on down the spine, we're going to come to the pelvis. Now, the pelvis is made up of different areas, again, different kind of bone structures that are put together. We've got the ilium, the ischium, the pubis, and the hip joint. With the hip joint, we have the acetabulum and the ball that's at the proximal end of the femur. So the femur is the thigh bone, and the ball is up at the top, which is where we form that hip joint. So the acetabulum is the area where that ball sits, and it allows us to have a pretty wide range of movements with our hip and our leg. Okay, we're just going to keep extending down to those lower extremities here. So I've already mentioned the femur. The femur is that thigh bone. Again, that leads us down to the patella, which is the actual kneecap. The femur comes together there with the tibia and fibula, which are the lower leg bones. And then those tibia and fibula bones come down to meet the ankle. Now, the ankle is made up of several different bones, and this is to allow us more movement. The lateral malleolus is lateral on the ankle. That's going to be towards the outside. The medial malleolus is on the inside, or medially by midline. And then the tarsals are the actual foot bones themselves. So again, there are many bones in your feet to give us the flexibility and allow us to support our bodies in an upright position that give us the ability to walk. The foot is made up of metatarsals. Yes, tarsals in the ankle to the foot, metatarsals in the foot. The calcaneus is your heel bone, and the phalanges are your toe bones. So the phalanges are just going to be those short, stubby couple of bones that make up each toe. Okay, we're going to jump up to the upper extremities here. First, we need to note the clavicle. The clavicle kind of goes across the shoulder. It's located kind of superior to the thorax, and it's going to extend from midline all the way out to your humerus. Now, the acromion process is the area in which that shoulder with the humerus and the clavicle kind of come together. We call this the acromioclavicular joint, or the AC joint. The scapula is your shoulder blade. That's going to be located posteriorly or on your back. The humerus is the upper arm bone. The radius and the ulna are the lower arm bones. So kind of like the lower extremities, the upper portion has one bone, the lower portion of those extremities have two bones each. And just to keep things consistent, you have a wrist that's made up of several bones. Also, your hand is made up of many bones. This allows for a lot of different movements, positions, and things like that. The wrist bones are called carpals, and the hand bones are called metacarpals and phalanges. So remember, with the feet, they're tarpals and metatarpals. In the wrist, they are carpals and metacarpals. And then the phalanges are both fingers and toes. So we don't have x-ray vision, right? But we know that the bones exist underneath our skin, connected to the muscle. And this just gives you kind of an image so you can see where those bones lie out underneath the surface of our skin. We have all of these bones, and they help form structure, but without joints, we would not be able to have the movement that we have. So joints are formed where the bones connect to other bones, and this can be through different types of joints that allow for different types of movement. When we talk about joints, we talk about ball and socket joints, which would be like your shoulder, the humerus. It would also be the head of the femur and the acetabulum of the pelvis. Hinge joints allow us to move in just one direction, so it hinges. When we think about a hinge joint, I want you to think about the knee and the elbow. They only go in one direction, essentially. A ball and socket can make a full circle. A hinge cannot. So we need to talk about the different muscles that make up the body, and it's important to note there are 3 different types. Cardiac muscle is unique in of itself, and of course you're only going to find that in the heart. We also have voluntary and involuntary muscle. So we're going to talk about these different types of muscle. Voluntary muscle is skeletal muscle. So voluntary meaning you control it. Involuntary is smooth muscle. We do not control involuntary muscle, and we're going to talk a little bit about more where you're going to find these things. But going back to the cardiac muscle has a unique feature called automaticity. And this is where the cardiac muscle can generate and conduct its own electrical impulse. This is when we get into cardiac, you're going to talk a little bit about the SA node and the AV node and how the heart rhythm itself is generated. But understand that if those normal triggers fail, the cardiac muscle can create its own impulse. And so cardiac muscle is pretty special in that regard. And here it is. The cardiac muscle is going to be found in the heart. Now, the skeletal muscle is what we have throughout our body controlling our movements. So skeletal muscle is, again, voluntary, and we have to think about it when we walk, when we pick something up. We tell our muscles to contract and to do those activities. Now, smooth muscle is unique because it's involuntary. Smooth muscle is found throughout the organs, and it helps with a thing called peristalsis. And peristalsis is the intestines, the esophagus, and the ability for it to create this wave-like motion to push things through. So when you eat something, this ripple-like effect from the smooth muscle helps to push those substances into your stomach, and then through your small intestine and your large intestine, and you know the rest. Another system we need to talk about is the respiratory system. The respiratory system helps to bring oxygen into our bodies through inhalation, and it allows us to get rid of carbon dioxide through exhalation. Now, All of the cells in the body require oxygen, and when they go through what we call aerobic metabolism and they use that oxygen, the waste product that is produced is carbon dioxide. So we must get rid of the carbon dioxide so that our body doesn't become toxic, and with that space then we can breathe in more oxygen. Okay, let's follow the track of air as it comes through the body when we deal with the respiratory anatomy. So we breathe in and air enters through our mouth and nose. It moves through the oropharynx and the nasopharynx, which are the openings behind or in the nose and the mouth. Now, once it enters that area, also known as the pharynx when we talk about both, the air moves towards the lungs. The trachea and the esophagus are kind of closely related, and the epiglottis helps to control which one is open at which moment. So the epiglottis closes over the glottis, and the glottis is the opening to the airway. So when the epiglottis is out of the way and we breathe air through the glottis, it's going to enter the larynx. And the larynx really is our voice box. This is where our vocal cords are located. And the cricoid cartilage forms the lower portion of this. The cricoid cartilage is your Adam's apple, if you can feel that on your throat there when you swallow. The trachea is the tube that the air is actually going to travel through in order to get to the lungs. We'll talk about the esophagus. The esophagus is the tube that gets food and substance to your stomach. But the trachea is a pretty rigid tube. It is surrounded by rings of cartilage, and that helps to keep its structure. As we travel down the trachea, we enter into the lungs. Now, at the bifurcation of the lungs, where it branches off, we have bronchi. So you have a right and a left main stem bronchi, and then those branch off into additional bronchi all the way out to these alveoli, which are like these little air sacs kind of at the end of those branches. And if you think about bronchus, think about the roots of a tree and how they spread out. You've got a big trunk, and then you've got the roots that start to break off, and they get smaller and smaller and smaller. And then at the end of those is where you're going to find the clumps of alveoli, which is actually where gas exchange takes place. So it's where the oxygen goes into the blood and attaches to the hemoglobin molecule, and the carbon dioxide is released back to exhale and get rid of. Now, the respiratory anatomy is pretty interesting because it's all pretty well controlled with the diaphragm. And the diaphragm is a muscle that lays at the division from the thorax to the abdomen. The diaphragm helps to adjust the negative air pressure inside the chest itself to help the lungs inflate and deflate. And here you can see an image just kind of representing the track that the air will travel that we just talked about. You can see the mouth and the nose with the oral and nasal pharynx. You can kind of identify there the trachea, the larynx and the trachea, where the vocal cords are, and how the trachea comes down and then bifurcates into the left and right bronchus. You can see the other image there on the right where it shows all of those little branching out sections of each bronchus to the alveoli. And again, picture the diaphragm sitting right there at the base of the lungs, dividing the thorax and the abdomen. Okay, now that you have an idea about the structures for the respiratory system, let's talk about how they actually work in order to get oxygen into our body and carbon dioxide out. So first of all, we inhale. And inhalation is an active process. It means it requires energy. The diaphragm and the intercostal muscles, which are the muscles kind of between your ribs, they contract. Now, when the diaphragm contracts, it actually pushes downward into the abdomen. And the intercostal muscles move upward and outward. So if you picture that it's making the chest or the thoracic space larger. This creates negative pressure and pulls air into the lungs. Exhalation, on the other hand, then, is a passive process, meaning it requires no energy. During this phase, the diaphragm and the intercostal muscles relax, and positive pressure then pushes air out of the lungs. Okay, here's one you need to get straight. When we talk about ventilation versus respiration, I want you to be careful because a lot of times we talk about what is the respiratory rate of a person or how many respirations per minute people will say, but that's not truly accurate. Ventilation is more of what we're talking about when we talk about how many breaths the person takes. And so when we talk about ventilation, we're actually talking about the movement of gases to and from the alveoli. So you breathe in, you breathe out, that's ventilation. Respiration is actually the exchange of those gases between the cells and the bloodstream. So the cells, the red blood cells in the bloodstream itself, and the alveoli that the gas exchange occurs in. So respiration is not something that we can really monitor or see with our eyes. We can have tools like a pulse oximetry to help us to identify how much oxygen might be in the body, but that's not really respiration either. So ventilation is the movement of air in and out of the lungs. Respiration is actual gas exchange. So when we talk about the physiology of lungs, now that we kind of know where that air is going in that process too, let's talk about oxygenated blood. Now this is carried from the lungs to the heart and then is pumped through the rest of the body. As I said, all cells within the body require oxygen. So it's important that we get the oxygen connected to those hemoglobin molecules and that we have good circulation in order to disperse that oxygen throughout the body. So at the cellular level, oxygen is exchanged with cells for carbon dioxide. So we pump oxygenated blood to the heart for it to circulate. As the blood is pumped back towards the heart, that is deoxygenated blood. And it's going to travel through and exchange its place with the oxygen, allowing us to get rid of the waste carbon dioxide and inhale oxygen. I want you to remember that children are not just small adults. There are some differences with the anatomy of a child versus an adult. For one, a child has a smaller nose and mouth, and a child has more space taken up by their tongue. So the tongue can become an obstruction in a child's airway, even probably more so than an adult's. Now the cricoid cartilage is less rigid and less developed. You'll find as we go through this course, we'll talk about how the bones are not as rigid or hard in children or infants as they are with adults. As we get older, our bones solidify or ossify, and that's when they get hard. And then as we get really old, they start to break down a little bit more and have osteoporosis. Now that doesn't mean they're flexible, it actually just means they're more brittle. But when we talk about children, the cricoid cartilage is less rigid, so it's a little more pliable. And the airway structures are more easily obstructed because of this. Because with those cartilage rings around the trachea for adults, it helps to protect the airway more. It takes a lot more force to compress those to actually close off the trachea. And again, the tongue is larger, allowing it to slip back in the back of the pharynx area and close off the airway for children as well. Okay, so you may have heard air goes in and out, blood goes round and round, and if there's anything wrong with those two things, you have a problem, right? So we've talked about air, let's talk about blood and the heart. So this makes up our cardiovascular system. When we talk about the heart, the blood, and the blood vessels themselves, sometimes we'll refer to them as the pump being the heart, the liquid being the blood, and the blood vessels being the container. Looking at the heart, you have 4 chambers, 2 upper chambers and 2 lower chambers. Now the upper chambers are called atria and the lower chambers are called ventricles. The atria are a little bit smaller, the ventricles larger, and the ventricles have a much thicker muscle mass. This is because the ventricles really have to push hard in order to send the blood out to the lungs and to force the blood out to the rest of the body. The blood travels through the right atrium first and then to the right ventricle. It travels from there to the lungs so that it can be oxygenated. It returns to the heart from the lungs and enters the left atrium. It goes down to the left ventricle, and from the left ventricle, it is then pumped out to the rest of the body, your fingers and toes and everything in between. So here you can see those structures of the heart. You can identify the right atrium and the right ventricle there, and you'll notice that purplish color vessel that is going to the lungs with the deoxygenated blood. Once it goes to the lungs and it comes back, it's going to come back into the left atrium and then down into the left ventricle. From the left ventricle, it's going to pump out to the rest of the body through the aorta. Okay, we're going to talk a little bit about the conduction system of the heart here. And I think it's important that you understand how the electrical impulse really travels through the heart so that you understand how that rhythm is created, allowing for each chamber to fill and to pump efficiently and effectively to really send blood throughout the body. So it all begins with the SA node, the pacemaker of the heart, that's found in the right atrium. You'll see then that it travels to the atrioventricular node or the AV node. From the AV node, you get that electrical impulse that's going to travel down through the bundle of His, down the bundle branches, to the Purkinje fibers. And that is, if you can see the Purkinje fibers wrap around the base to the sides of the heart through the ventricles, and that is going to allow it to then squeeze kind of from the bottom up, pushing that blood out into the vessels it needs to travel. So that would be to the lungs or out to the body. So I already mentioned kind of how that blood flows, but knowing the names of these vessels is also going to be important. So we have the coronary arteries. The coronary arteries are what feed the heart muscle itself with blood. The aorta is the large vessel that comes off of the left ventricle, pumping blood to the rest of the body. The pulmonary artery is the vessel that comes from the right ventricle, traveling to the lungs. The carotid artery is the artery that carries blood up through your neck, up to your brain. And the femoral artery is found down in your groin. As the vessels get further and further away from the heart and further away from midline, they start to get smaller. So the larger vessels are going to be the aorta. As it comes down, the aorta, descending aorta comes down through the core of the body, kind of running just to the left of the spinal column. And from there, it's going to bifurcate down into the femoral arteries, one going to the left and one going to the right, to then feed our lower extremities. And of course, we have vessels that are going to feed our upper extremities. So the brachial artery is going to be one of the larger vessels that comes out to each of our arms. The radial artery is where we will learn to feel for a pulse, down in the wrist. The posterior tibial artery and the dorsalis pedis artery are found down in the ankles and the feet. You can feel pulses in your ankles and your feet as well. Wherever there is an artery that is really close enough to the surface, we should be able to feel the pulsation through that vessel, and that is with every beat of your heart. So as we're looking at this image, I want you to understand that we start with arteries with oxygenated blood. Now arteries are pretty elastic and the blood is going to flow through them. As it gets out to the fingers and toes, or as it gets to the areas where it's going to be supplying oxygen, it crosses over into what we call capillaries. These capillaries are very, very small, and it actually is so tiny only one red blood cell can really go through at a time, and that's to allow ample time for the oxygen to offload here and to pick up the carbon dioxide so that we can get rid of that waste. As those capillaries come back together with the carbon dioxide that it's picked up, we develop into veins. So you have arteries to arterioles to capillaries, and then venules to veins. The interesting thing about veins is veins have valves. The idea is that in the arteries, you have the heart pumping, and so it's constantly being pushed. But when you reach the side of the veins, it really doesn't have that force behind it anymore. And so we need the valves to prevent backflow. We don't want the deoxygenated blood to go back into the capillaries. We want it moving in one direction, so those valves prevent that backflow. Blood is made up of a couple of different things, one being the plasma. The plasma is the liquid portion of the blood. It's really more than half the volume. Red blood cells make up another part. This is red blood cells, erythrocytes, and red corpuscles. White blood cells, or leukocytes, and white corpuscles. And then our platelets. Now, red blood cells carry oxygen for us. White blood cells help fight infection, and platelets help with clotting. So when you have a cut or something, this allows the blood to form a scab or kind of a cap on that bleed so it doesn't continue. As I mentioned already, we're going to be teaching you how to feel for a pulse. And there are a couple of different things that you're going to be paying attention to. But a pulse is really the pressure of blood flowing through that artery. And again, remember it's all arterial, and it's where the blood is coming from that left ventricle. So if we don't have a good enough contraction, you're not going to feel a pulse. But it can be felt by slightly compressing an artery over a bone in several different locations of the body. We're primarily teaching you to identify a carotid pulse, as you did with CPR, or a radial pulse. There are a lot of locations, though, in which you can feel a pulse. For the peripheral pulses, so periphery is outer, we've got the radial in the wrist, we've got the brachial kind of in your underarm or your armpit area, we've got the posterior tibial, which is back kind of on the back side of your ankle medially or inside. And then we've got the dorsal pedis, which is found on the top of your foot. Central pulses can be felt at the carotid or at the femoral artery. The carotid and the femoral pulses are going to be stronger, mostly because they're larger vessels and they're more centrally located. So as I said, these pulses more towards the central area of the body are going to be a little bit stronger. Now, when we have issues with our blood pressure and our blood pressure is too low, you may not be able to feel a radial pulse on someone, but you could still feel a carotid or a femoral pulse. And this is because of the location in relationship to the heart and the size of the vessel. So this is why in CPR we teach you to feel for a carotid pulse before you start compressions. When we are assessing someone generally, we're likely to feel a radial pulse and identify some factors with that. So blood pressure, this is the force that is exerted against the walls of the blood vessels as the blood is coming out of that left ventricle. So systolic is our upper reading. That is the arterial pressure when the blood first leaves that left ventricle. So you can imagine the systolic pressure is going to be a bigger number than the diastolic. The diastolic is the lower number that you're going to have in that reading, and that's the pressure when the left ventricle is refilling. So it's kind of at a resting point for the vessels. What is the resting pressure against the sides of the arteries? Perfusion is important to understand because perfusion addresses the body's ability to meet the demand for oxygen. And when we have an adequate amount of oxygen and nutrients, then we know that the body is usually perfusing well. We also have to include a little bit of that getting rid of the waste products so that we can maintain a healthy body. Now, hypoperfusion is when we don't meet the needs of the body with the oxygen. So the supply is not meeting the demand, if you will. And because of that, it can develop hypoperfusion, or another name, we call this shock. So how is the function of the respiratory system related to the function of the circulatory system? Well, they really depend on each other because the respiratory system has to oxygenate the blood, and then that oxygenated blood needs to be circulated by the heart. Again, if the heart isn't able to pump and do its thing, the lungs aren't going to get the oxygen they need to continue to work properly either. So these two systems have to work together, and that's why sometimes we call it the cardiopulmonary system. So yes, the heart and the lungs are the life support of our bodies, and perfusion is going to be dependent on our ability to get oxygen in, circulate it, and offload the waste products. So we want to oxygenate cells and get rid of carbon dioxide. Briefly, we need to mention the lymphatic system. This is kind of a circulatory system all in of itself. It doesn't include blood though. This is where we kind of capture fluid and help maintain the balance of fluid throughout the body. As we talk about the lymphatic system, we do have lymphoid organs, and these include the adenoids and the tonsils, which if you've ever had strep throat or tonsillitis or pharyngitis, right, this is inflammation, irritation of the tonsils. We also have the spleen, which is a relatively blood-rich organ, but again, it helps us to fight infection and kind of circulate those white blood cells and things. The thymus and the nodes, or your lymph nodes, these are also part of your lymphatic system, and we need all of this to be working in order to maintain a healthy life. Now we do want to mention the lymphatic system is important because with that, in a patient who's had a mastectomy, we want to avoid taking blood pressures on the side where that mastectomy was performed. And this is because they've likely removed some of the lymph nodes, and by using that extremity for blood pressures, you are kind of adjusting the pressures within the arm and potentially causing issues with the lymphatic system, especially if some of those nodes have been removed. So please be sure if you have a patient who tells you they've had a mastectomy, we don't want to use that extremity. If it's all we have, then by all means, we're going to use it. All right, on to the nervous system. So the nervous system, we have a central and a peripheral nervous system. We're going to break that down a little bit for you, but you can see here in the image, we're talking about the brain and the spinal cord as being our central nervous system, and the peripheral nervous system is everything past that. Again, brain, spinal cord equals central nervous system. You may see it abbreviated CNS. And the peripheral nervous system is made up of sensory nerves and motor nerves. Hopefully you can identify what that means. Sensory means we're going to be able to sense things by touch, hot, cold, soft, whatever. And then motor nerves are the nerves that allow us to move. Remember, with that skeletal muscle. This may be abbreviated PNS for peripheral nervous system. And then the autonomic nervous system includes all of those involuntary motor functions with the smooth muscle we've talked about earlier. Remember, these are the involuntary motor functions like the peristalsis and the other activities within the body that you don't even have to think about. The digestive system provides the mechanism by which food travels through the body and then is digested. We need this digested food in order to maintain bodily functions. So when we talk about the digestive system, we're dealing with the stomach, the small intestines, and the large intestines. As part of the digestive system, we talk a little bit about the liver, the gallbladder, the pancreas, the spleen, and the appendix. So the liver really helps to metabolize things. When we take certain medications and that, it helps to break it down so that we have that therapeutic effect that we're looking for. The gallbladder produces bile, and bile helps us to digest fats and different things that we eat. The pancreas is important because it creates insulin, and insulin helps to regulate our blood sugar. The spleen is important with our immune system, again, and the lymphatic system together. And the appendix is kind of this weird little doohickey that hangs off of the large intestine and doesn't really serve a purpose, but it's there and we know it can cause us some problems at times. So let's talk a little bit about the integumentary system. This is really the skin. So the skin has several functions. One is protection. It keeps bacteria and viruses from getting into our body. When we have a cut, sometimes that allows that infection to get into the body, and then we can have issues with that. It helps with water balance and keeping our electrolytes and things in check. It also deals with temperature regulation. When you get really hot, you sweat, and when you get cold, you shiver. Excretion. Yes, there are things excreted through our skin. Sometimes this is a normal process, and other times excretion occurs through the skin when our body is not working appropriately. And then shock. This is our kind of our cushioning, our barrier, keeping all of our organs and things safe inside of our body. There are different layers to the skin itself. The epidermis is the outermost layer. The dermis is the middle layer, and then the subcutaneous layer has a lot of the elements that we think about when we think about the skin. We'll move on to the next slide, which will show you a picture and illustrate that better. The skin is made up of multiple layers, including the epidermis, the dermis, and the subcutaneous. The epidermis is the outermost layer. The dermis is the layer in between. This includes hair follicles and sweat glands. And then we have the subcutaneous layer. This is where our fat is and most of our blood vessels are going to be traveling through. The skin is made up of different layers, including the epidermis, the dermis, and the subcutaneous. The epidermis is the outermost layer. The dermis is the middle layer that's going to have our hair follicles and such. The subcutaneous layer includes the sweat glands, the arteries, veins, and the nerves. Here is an illustration of those layers of the skin, where you see the epidermis, those outer layers, the dermis, again with the hair follicles and sweat glands, and then as we travel into the subcutaneous layer, you see those larger blood vessels. Here's an illustration of those layers of the skin. The epidermis is the outermost layer. You can see the dermis is where we have those sensory receptors and the hair follicles and things, just kind of in between. The subcutaneous layer, again, has the sweat glands, the veins, the arteries, and the nerve cells. The endocrine system is one of those more advanced systems within the body. And I say that because it produces hormones, and then it regulates those hormones to control many of our bodily activities and functions. When we think about the pancreas, understand that's part of the endocrine system, again, with the production of insulin. We also have the adrenal glands that help secrete epinephrine. And epinephrine is going to be important as we talk about the fight or flight system and how the body is going to respond in certain situations. The endocrine system is pretty intense, and it includes a lot of different areas, again, with the production of hormones and how those hormones regulate different functions within the body, everything from ovulation with reproduction to insulin to our temperature regulation. The endocrine system has a tie into many of those things. I'm sure you have all heard about the renal system. Now, the renal system is our urinary system. This is going to help us get rid of those waste products that we don't need, that we have after we've metabolized food and things of that sort. It also helps us to regulate fluid levels. It helps us to adjust our body pH. If we don't maintain a certain pH, then everything in our body can get out of whack here. And the renal system also will help to filter chemicals. Things like sodium, potassium, and all of those electrolytes are going to be regulated through the renal system in the kidneys. Now, the kidneys are that primary organ here of the renal system. The bladder is also included here. The bladder, though, is just a reservoir for the urine that's produced in the kidneys. And again, when you go to the bathroom, you empty your bladder. So here you see the renal system. We're really dealing with the kidneys. The blood circulates through the kidneys, and this is a filtration system to help pull out waste products, to pull off excess fluid, things that we don't need, to get rid of it. From the kidneys, we have ureters. The ureters are where the urine flows down to the bladder, where it's held until it's excreted through the urethra. Again, here you can see the ureters transport the urine to the bladder from the kidneys, and the urethra is how it exits the body from the bladder. Now we're going to get a little unique here because we need to talk about men versus women. So the male reproductive system is different from a female reproductive system. The male reproductive system includes the testes and the penis. Taking a closer look, within the testicles themselves, you have the epididymis, which stores the sperm, the vas deferens, which is the tube that transports the sperm to the urethra, and then you've got a couple other structures that help to secrete semen to transport that sperm. Taking a look at the female reproductive system, the structures that we need you to be familiar with are the ovaries, the uterus, and the vagina. For females, the ovaries are where the eggs are stored until ovulation. The fallopian tubes transport the egg to the uterus. The uterus is where the egg would implant if it were going to grow into a baby for pregnancy. We also have the vagina, which is where intercourse takes place, and the vulva, which is just some soft tissue structures there at the opening of the vagina. We do talk a little bit about breasts with the reproductive system because this is an organ that produces milk for the child once it's born. All right, we've reached the chapter review. So as an EMT, your knowledge of the anatomy or structure and the functions or physiology of the body will be important in allowing you to assess your patient and communicate your findings accurately and efficiently to other EMS personnel and hospital staff. If you don't understand how the body works and why, then it's very difficult to identify what's going on with the individual and how you might be able to assist them. We've talked about the major body systems, including the musculoskeletal system, the respiratory system, the cardiovascular system, the nervous system, and the digestive system. We also discussed the integumentary system, or the skin, the endocrine system, dealing with hormones, the renal system, and the reproductive systems of both the male and female. So some of those key points to remember: cellular metabolism requires a constant supply of oxygen and glucose. Remember, all cells of the body need these things to function efficiently. The absence of either of these causes disruption in normal metabolism, and again, this requires more energy, more work from the body in order to overcome. Now, the cardiopulmonary system combines the functions of respiratory and the cardiac system, and this helps to provide oxygen to all of the cells within the body. When the demand of those cells within the body is not met, a condition called shock is present, and this is hypoperfusion. The body is composed primarily of water, and this fluid is distributed throughout the body systems. So let's think about this. When evaluating a patient with a cardiac problem, consider the impact on the respiratory system. When evaluating a patient with a respiratory problem, consider the impact on the cardiovascular system. What impacts do problems in these systems have on each other? Well, we know that the cardiopulmonary system, they work together, these two, and really, if one is not doing well, the other is not going to do well either. They depend very heavily on each other in order to perfuse the body appropriately. Shock is a serious condition, and it should be recognized as soon as possible, because the sooner we intervene, the better outcome our patients are going to have. So what is the pathophysiology of shock? That hypoperfusion, right? Not having the oxygen that the cells need within the body. Okay, a little critical thinking question for you. You are treating a patient who was recently released from the intensive care unit with a massive infection, also known as sepsis. This has impaired the patient's ability to regulate the size of blood vessels. So, how might this affect the patient's ability to compensate for any additional illnesses? What steps should you take to help this patient compensate? So, the body usually adjusts, dilates, or constricts the blood vessels in order to help maintain blood pressure and to keep blood flowing at an appropriate level. Now, if we have someone who no longer has the ability to vasoconstrict or vasodilate those vessels, then that's going to be an issue, and it could lead to problems with temperature regulation, oxygenation, and other issues as well. Let's go through these last couple slides here. We've got talking about the skull. The frontal bone is at the forehead. There is one frontal bone. Underneath are the eye sockets surrounded by the orbits on the outside. The lacrimal bone is on the inside, and the nasal bone is there in the center. Underneath these are the zygomatic bones, or the cheekbones, and the maxilla, which is the upper jawbone. The mandible is the lower jawbone. The side of the skull is made up of the temporal bone, so you have one on either side. And at the back of the skull, we have a pair of parietal bones at the top and the occipital bone is a single bone located across the bottom and the back of the skull. Sutures along the skull indicate where the bones have fused, and when we're dealing with an infant and younger children, these suture lines are not fused, and that's why you have a soft spot or a fontanelle in an infant. As we get older, though, and our bones ossify or harden, these sutures kind of grow together and they harden and seal. So looking at the posterior aspect, or the back of the body, we have the back of the skull, which then meets up with our spinal column. And the spinal column, understand, is broken into different sections of vertebrae. We have 7 cervical vertebrae, we have 12 thoracic vertebrae, and we have 5 vertebral vertebrae. So taking a posterior view of the body with the bones, we are looking at the back of the skull, which then connects to the spinal column. The spinal column is made up of vertebrae, with the first 7 being cervical vertebrae, the next 12 are thoracic vertebrae, and the last 5 are lumbar vertebrae. We also have the sacrum and the coccyx, or the tailbone, and the sacrum and coccyx are fused vertebrae. Continuing through some of those illustrations and thinking about the bones, after we deal with the skull and the spinal column, we also have the clavicles up at the top of the shoulders. We have the sternum and the ribs. The scapula is your shoulder blade. And we have our upper extremities with the humerus, the ulna, and the radius, the carpals in the wrist, and the metacarpals of the hand. Remember, the fingers and toes are both called phalanges. The pelvis then is at the base of the spinal column and breaks down into the 2 lower extremities with the femurs, the patella or the kneecaps, the tibia and fibula of the lower legs, the tarsals of the ankle, metatarsals of the feet, and then again the phalanges of the toes. If you recall the image of the respiratory tract, we were looking at how air comes in through the nose and the mouth into the nasal and oral pharynx. It then enters into the larynx and the bronchial tubes after traveling through the trachea. The lungs are the last area in which they travel. As those bronchioles branch off smaller and smaller, we have the alveoli at the base of those bronchioles where gas exchange actually takes place. Please remember, children and adults have slightly different structures when it comes to the airway as far as the size and shape. So when we're dealing with children, smaller noses, smaller mouths. However, their tongues are quite large and the trachea is more narrow. The cricoid cartilage is not as rigid as that of an adult's, and their airways can be easily obstructed, and therefore we need to be watching out to make sure that we keep that airway open. We talked quite a bit about the heart and the different chambers of the heart. Remember, you have 2 atrium, you have 2 ventricles. The blood travels from the right atrium to the right ventricle and out to the lungs. It travels back to the heart, entering the left atrium, traveling down to the left ventricle, and then out through the aorta to the rest of the body to oxygenate. Remember, the cardiac muscle has that ability to conduct electrical impulses and automaticity, which allows it to generate its own electrical impulses. This impulse typically begins with the SA node, traveling to the arterioventricular node or the AV node. From here, it travels down the atrioventricular bundle to the bundle of His, the bundle branches to the Purkinje fibers, where we then get that large ventricular squeeze. This was the slide representing the arteries to arterioles, to capillaries, to venules, to veins. So we go from a larger vessel, breaking down smaller and smaller till we get to those capillaries where we really have just a 1-cell diameter, allowing the red blood cells to transport through there, offloading oxygen and onloading the carbon dioxide. Then those vessels kind of come back together to venules and veins, in which then it travels back to the heart to recycle again. Again, the endocrine system consists of a lot of different elements and again controls many of our bodily functions, including temperature, metabolic rate. So we'll talk more about this later on, and we talk about the disease states that involve the endocrine system, but kind of keep in mind of all the little areas that it does include. Appendix 10 is referring back to the renal system image, and here we were looking at the kidneys, how urine is produced there in the kidneys, traveling through the ureters to the bladder, and then the bladder to the urethra. The bladder, remember, is just a holding tank for the urine. It doesn't really have any other function. Appendix 11 is dealing with the male reproductive system, and we've kind of talked our way through that. We also had an image of the female reproductive system and how the different structures within the female anatomy versus the male anatomy and how they function. We also talked about the female anatomy and the differences between the male and female anatomy and how they function. That concludes Chapter 6 lecture.